So a week ago, the President signed the health care reform bill. For everyone's notes, it's called the Patient Protection and Affordable Care Act. And then yesterday, he signed the Reconciliation Bill, which is the Health Care and Education Reconciliation Act. And those two together lay the framework for affordable quality health care for all of our citizens. And I just want to lay out a few of the things that it does for Michigan today and before 2014, which is when it fully takes effect. So, healthcare costs are going to be reduced for the middle class. Again, this all kicks in fully in 2014. Healthcare decision-making now shifts away from insurance companies to people, allowing people to take control and make decisions about their health care. Insurance companies will be prohibited from canceling your health care coverage if you get sick. Later this year, insurance companies are going to be prohibited from denying coverage of pre-existing conditions for children. And starting in 2014, those who have pre-existing conditions who are adults will also be able to keep their health care coverage. And for Michigan, that's about 140,000 adults. Individuals and small businesses will receive tax credits to make health care coverage more affordable. There will be health care options for, there's 1.2 million uninsured people in Michigan today. The expansion of Medicaid will allow for another 375,000 people to fall under additional Medicaid expansion. And for those who are individuals who have health care policies themselves, often if you're buying it as an individual, it's much more expensive. That's about 459,000 people who purchase today individual health care coverage. The options for them will be much more affordable. Young people, starting this year up to age 26, will be able to stay on their parents' health insurance policies. That's 950,000 people in Michigan. 950,000 young people between the ages of 18 and 26 who will be able to stay on their parents' health insurance policy. More federal funding will be coming to the 184 community health clinics. Those are federally qualified health centers, and Janet Olszewski, who's standing here with me, will describe a little bit about what that means. And for seniors, the news gets even better. Now, let me just be really clear about this, because I think there's been a lot of fear out there about what this health care reform does. For those who are on Medicare, this does not change your doctor. It does not change your health care coverage. In fact, for you, it's going to get better. There are seniors who qualify for coverage under Medicare Part D, and that relates to prescription drug coverage. People have referred to the donut hole, where once the seniors hit a certain limit of their health care Medicare Part D, and that means $2,830. Once they've spent that much money, which they get covered up to, after that, if they have a lot of prescription drugs, they have to pay for it on their own up to an amount that is a catastrophic coverage. That's $4,550. So that's what's called the donut hole. So this year, that donut hole starts to close, and it will close entirely over